Good afternoon, everyone. Good afternoon. Welcome to the noon session. Hello, hello. My name is Dorothea Vafiatis, and I am the Senior Director for the Center for Healthy Aging at the National Council on Aging. It's my privilege to moderate our panel today on exploring health literacy's role in healthy aging. As the aging population continues to grow across the nation, the well-being of older adults has become increasingly a significant concern. Understandably, promoting healthy aging is more critical now than ever. So health literacy, defined as the ability to obtain, process, and understand health information, is innately interconnected with healthy aging. Health literacy plays a significant role in promoting better health outcomes and fostering independence and really enhancing overall quality of life for older adults. So even with all that positivity, a majority of adults face difficulties when it comes to understanding their health information. So this underscores the pressing need to address the health literacy challenges faced by our nation's aging population. In this panel, Dr. Alena Baquet-Simpson, Aetna Executive Medical Director, and Kavitha, Nanduri, Executive Director of Aetna Medicare Stars, will provide a comprehensive look at the connection between health literacy and healthy aging, focusing on the tangible impact. We'll be talking about the impact on a person's total health. So let's get to it. I'd like to kick it off and ask each of you, thank you for being here, ask each of you to give us a short introduction about your role at Aetna, and then tell us what you think and how you define health literacy.
Okay. So I'll start, and as Dorothea said, I'm Alena Baquet-Simpson, Executive Medical Director, Aetna CVS Health. I support our Medicare business, and in my role, I have a team where we work with value-based providers trying to optimize quality in terms of measures that are achieved. Also, for the last several years, I've been the physician lead for our Medicare health equity work. And I'm very happy to be here this afternoon. Thank you.
Thank you.
Thank you. I'm just testing my mic. It just fell off. Sorry about that. I'm Kavitha Nanduri.
I think it's working.
Okay. I'm Kavitha Nanduri. I work in the Medicare area. I have a huge focus on health equity and working with underserved populations, and very happy to be here.
So tell us, what's the definition, how would you define health literacy?
So health literacy, Dorothea said it briefly earlier, is our ability to get, process, and understand healthcare-related information and services. So it's really three parts if you break it out. It's, how are you getting this information? And when you think about seniors, when I think about my mother or my father, a lot of times they get their information from social media. Mm-hmm. And then how well are they able to understand the information? So the focus really is on taking that information and applying it when you have a problem or when you're interacting with the healthcare ecosystem. And then you have organizational health literacy, which is how are we providing people with the tools and making it easy for them to access this information? Are we training our customer service reps? Are we training the people that interact, especially with seniors, to make sure that the information that they get is understandable in a simple and easy language? Now, health literacy is also an overarching goal for Healthy People 2030, and where they clearly define and say that achieving health literacy will help the health and well-being of everyone. Health literacy is very expensive, and it really costs the healthcare ecosystem quite a bit. So, Dr. Alena?
Yes, to be comprehensive, I think in terms of definitions, we need to also address health insurance literacy. which is a person's ability to seek out, obtain, understand health insurance coverage, and then once enrolled, be able to apply that coverage, use it to be able to access needed services. So very important.
That's right. And Kavitha, tell us about what does it look like today in the population? How much health literacy is out there? What's the numbers?
So it's really interesting, right? One, as I mentioned, it's very expensive. We're talking of upwards of about 100 million to 230 billion in terms of costs here on an annual basis. So it's very expensive. Now, 9 out of 10 seniors or adults are identified as having low health literacy skills. Now, what does that mean, right? Let's break it down. So recently, and I think we've all been guilty of this, we walk into a lab like Quest or LabCorp where we have to get some tests done. And they give you a time, they give you a slot, you show up there, and they give you a bunch of forms and a pad and say, please fill this out and give us your consent, right? And we look at the list of forms and we just go all the way to the end and say, initial here, sign here, and we're done. And so recently, this was a story that we heard where the person did the same thing, completed the lab tests that were suggested or recommended to them. And then the bill came after a month for about $2,500 out-of-pocket expenses, right? And so the person was like, well, I'm educated. Why didn't it strike me to ask the person what these tests are for and how much do they cost in advance, right? So it doesn't mean the test is incorrect. It just means we would have liked to know up front if there was something that we were charging. So, low health literacy can come to us in multiple ways. And for Medicare especially, this is supposedly the golden decade, right? And it's called the golden decade between 2020 and 2030 because every day you have 10,000 people aging into Medicare. And right now we have about 60 million Medicare eligibles, and it's going to be 90 million by the end of this year. So in terms of us working with all of these Medicare eligibles in the healthcare ecosystem, it's a strategic imperative for us to really address health literacy.
And I would just add, in terms of current state, that there was a 2019 publication that talked about a study of over 15,000 adults that showed that the majority had very little understanding of basic health insurance terms, and the majority also had little understanding about how to use their benefits. So this points out to us that health insurance literacy is a major problem for our communities, and it impacts some more than others, like seniors, like marginalized populations, such as minority populations, low-income populations, uninsured, but it can also impact young people who are aging out of their parents' health coverage. Now what do I do? And additionally, any of us, if we find ourselves on the other side, on the patient side or caregiver side, all of a sudden, all that we're seeing in the healthcare system it often becomes overwhelming. And there was another study that talked about how low health insurance literacy could be a barrier to utilization of services we want people to use, such as preventive care, primary care, medications. And what we could do is implement strategies at the point of navigating the healthcare system to try to really, such as using plain language to explain what's covered, what's not, to really escalate or encourage appropriate cost-effective utilization.
Yeah, that's right. Can you elaborate, Alena, more on how health literacy impacts quality of life and aging well?
Okay. Well, health literacy definitely, absolutely impacts healthy aging. Seniors should be able to live their best lives, and that means taking active steps in terms of preventing disease, managing chronic conditions that tend to increase in prevalence as we age. And we have to also keep in mind that health equity and health literacy are intertwined. We define health equity at our organization as everyone having a fair and just opportunity to obtain or achieve their best health. You can't do that, and you can't live that good life if you're not understanding basic health terminology and how decisions you make about diet, exercise, taking medication, following through with a treatment plan, how that all impacts your health and potential quality of life. And as we think about the impact of health literacy on healthy aging, we need to consider all forms of communication where health information is shared. So there's verbal, written, but also digital. And I wanted, Dorothea, just to highlight digital for a minute because so much has evolved with digital over time. There's so much more information available to us online, just information about conditions and treatment options and so on, but also our healthcare providers, whether that's physicians, our labs, or hospitals, have portals that we can use. We can go in and make appointments. We can see lab results. And we can also use telehealth services. So much out there. What used to be the case was that with seniors, you say technology or digital, and you think the two don't mix. But over the last several years, seniors have been beginning to use the internet more, seeking online services.
Yes.
And we know that you mentioned that they're using social media, not just to socialize, but also to get health information, joining groups, clicking on links, all of this. So the situation we have is that we have availability and access to all this information. We have seniors who want to take advantage, but there's a JAMA article that talks about how when Medicare beneficiaries were surveyed, 41% nearly did not have access to a computer or broadband, and 41% did not have a smartphone with a wireless plan. So how do we avoid leaving behind this large chunk of seniors? I think that's something that we need to continuously ask ourselves. We have a low digital health literacy strategy at Aetna, and I want to point out the problem statement because it really elucidates the challenges that we face. And it goes something like a technology-enabled healthcare is built on a foundation that has certain assumptions. One is that people have access to broadband. We've just said a chunk of people do not.
Yeah.
Another is that they have access to technology. A chunk of people do not. And then the third assumption is that there's basic level of health literacy skills to enable people to interact. So definitely challenges ahead, lots of work to do.
Definitely. That sounds like quite a long list of barriers. Are there any other barriers that older adults are facing to getting health literacy or improving their health literacy?
Yes, there actually are. I want to talk a little bit about changes that occur with aging. And age actually is one of the highest correlates of poor health literacy. We have about 71% of older adults who have trouble using printed materials, about 80% who have trouble using forms and charts, and another 68% who have trouble with numbers and calculations, and all of those skills are important in health literacy. Now put that together with some of the changes with aging, there's changes around cognition, and I'm not talking about dementia. Dementia is not a normal part of aging. But as we age, and these are generalizations, when you look at individuals, there's large variations, but in general, as we age, cognition slows. It takes longer for things to sink in, for us to process information. And also, there can be problems with vision. Out of all the adults who are visually impaired, 2/3 are seniors. And then there can be problems with hearing. And about 1/3 of people 60 and over have hearing problems, and about half of those over 85. So you put all of that in the context of the current state of our healthcare delivery system, and you think about our visits with our providers, our doctors, they're rushed. So how does that work for somebody who's having trouble processing?
That's right.
If they're trying to explain to someone how to take medication or instructions to follow up after the visit, if someone's struggling to hear or to see what's being explained to them, it makes things that would otherwise be understandable now not be understandable. So there's lots of work to be done there.
Yeah, the only thing that I will add is it's hard for people to acknowledge that they have low health literacy, right? And so there's a fear of being shamed. There's a fear of admitting to say you can't read well or write well, and that you don't understand what the doctors or whoever you're interacting with is saying. So how can we create those safe environments where people don't feel shamed, right? They feel comfortable enough that they can ask questions and ask, the answers to be repeated in a way that they can understand. So it's harder being a senior, especially with chronic conditions and other life changes. And I feel we shouldn't be making it any more harder for them, right? What can we do to simplify it for them?
Well, and add on top of that, ageism that often is seen in the healthcare provider's office, or stigma and bias against certain conditions. And that's a very large challenge to deal with, right? Compounding on the health literacy problem.
Right.
So tell me a little bit more about the potential consequences of low health literacy for older adults. What have you seen?
Well, health literacy, I think you mentioned that at the beginning, is associated with health outcomes. Greater proficiency with health literacy is generally associated with better outcomes. And for those who have lower proficiency with health literacy, they have poorer outcomes. They may experience increased hospitalizations. They could experience higher healthcare costs. Now think of the consequence of that for seniors who might already be on a fixed income. There could be more medication errors or poorer adherence to medication, a delay in seeking care when it's appropriate, and also less preventive care. And for example, instead of getting routine mammograms, you could put those aside, and then when you finally get the test, find cancer, breast cancer, in a more advanced stage. We have lots of examples where our members put off taking medication because they're not quite understanding their health coverage. I have a quality nurse on my team. Her name's Shanita. On a daily basis, she calls out to members and tries to work with them on being more adherent to their medication, trying to get at the root cause of what's driving this. She spends a lot of time explaining what the coverage is, how they can maximize their benefits to have lower out-of-pocket, how they can get that medication in hand easier for them, maybe delivered to their home. And while she's speaking to them, she tells them about other benefits that might help, like transportation if they need help getting to the doctor, or maybe they have high blood pressure and need a blood pressure cuff to monitor their hypertension.
A teachable moment.
Yes. So.
And would you add anything?
Yes, I'm going to tell a story here.
Okay.
Where, as Dr. Alena said, we also have healthy coaches, we have pharmacists who make outreaches. And so one of our healthy coaches shared this story with me where she had picked up the phone and called a member to ask her to get her mammogram done. But the member had a question where she said she had seen a doctor the previous week, and she was diagnosed with a chronic condition, and the doctor was giving her medication. She distinctly remembered the doctor telling her that she had to take 1 pill a day. So she got her prescription, she filled it out, and now she has the bottle that came back, and on the bottle it's clearly written, and it says, take 2 times a day. And she did not want to call the doctor's office because she felt, uncomfortable saying, oh, maybe I didn't understand the instructions, and she thought they're too busy and they're not going to know what I'm talking about. So the health coach, spoke to the doctor's office, and what had happened was it was the wrong prescription for the wrong person. Now, if this person hadn't received this call and she would have taken the medication, whether it was once or twice, but it was a medication not for her chronic condition, which could have led to other problems down the line, right? So, it's having that comfort level, one, for you to pick up the phone and talk with your doctor's office, but we're in that ecosystem, we're interconnected, right? And so we have each other's backs in terms of trying to make sure that the person is getting the right care that they need. So low literacy can occur in, different ways.
Thank you. Yeah, that's very important. Let's see. So, what specific steps is Aetna taking to boost health literacy, and how do you think this contributes to barriers?
So we have a number of initiatives. We're a pretty large organization, but for Medicare, we're very excited because this year, especially for health literacy, what we've started doing is we have access, to a lot of member-level data, to a lot of social determinants of health, factors that identify and say what's unique and what's different. For a long time, a lot of programs and initiatives are all about equality, right? Is everybody getting the same materials? Is everybody getting the same opportunity for all of the initiatives that you roll out? But now it's transitioning to equity, which is, are we understanding the differences in the unique population that we meet? So one of the things our team is working on is creating a health literacy score at an individual level. And we're very excited about this because the possibilities that this gives to us, right? When we have customer service or when we have a health coach or pharmacist talking to a person, if they know that this person has low health literacy and we've given them the training, now we have a greater opportunity to work with that member in a supportive way. And then we plan to share the same information with the provider ecosystem, with the community organizations that we work with, right? So now, you're being proactive and you know that the person walking in through your door has low health literacy. So, so that's one of the initiatives that we're very excited about. I'm going to ask Dr. Alena.
Sure, I'd like to talk about some of the work that we do with community-based organizations.
Yes.
As part of our health equity work, we have been working with community-based organizations trying to add additional value to events that they already have planned. So we bring educational materials, we'll bring things like immunizations. We've sponsored education on healthy eating. We've sponsored healthy cooking demonstrations, provided information on mental health, heart health. We staff the events with community health workers who are of the community. They look and sound like the community and can quickly form connections, find commonalities and form connections with the participants, and they're able to leverage that to then be able to influence people to understand, help them understand how taking advantage of the services being offered and the resources being offered can really help their health. Some of the greatest success we've seen is working with the same organizations and the same communities over time, where we've had a chance to, through multiple events, establish relationships, form a presence, and become a trusted resource.
Alena, thank you for that. That's very important because I know we have a lot of audience members that are community-based organizations and senior centers. But can you tell us about any specific partnership?
Yes, well, one that I want to mention specifically is one we're getting ready to launch is the Neighborhood Connect Technology Initiative.
Okay.
It's out in Texas area. It's in a low-income community where about 70% of the individuals don't have access to computers and broadband. And we're working with the church and various community-based organizations there, bringing in computers, iPads, and at the church we're actually building these soundproof pods, if you will, little booths that can be used for the members to have telehealth visits, where or otherwise they wouldn't have access to that. We're going to staff with community health workers who are going to help address the technology issues of getting connected, make sure that that goes smoothly, and they'll also be available to answer questions and review any other health information. So I'm really excited about that.
That is exciting.
Yeah, one other thing that we have is, we're part of CVS Health, which is the broader organization, and CVS Health has launched last year a Community Equity Alliance, which specifically, identifies disparities in local communities and partners with organizations there. Right, so it's not a one-size-fits-all approach. In Illinois, they launched one of the programs they did was laundry and literacy, which is, so they set up shop.
Alliteration. Laundry and literacy. I like that.
Yes. And so they set up shop in, a laundry place and provided training, health literacy training and coaching, and offered free detergent to anybody who showed up there. And it was hugely successful. We also have like a healthy aging support program where we provide a 6-week coaching program to members, and it's one-on-one. There's health literacy, there's education, there's diet, there's exercise, and it's catered just for their unique needs. And we're also evaluating some options about, how can we take this program further and partner with other community organizations too.
We're also providing training, access to training on health literacy to our network providers and the clinical staffs in their offices. And really excited about 2 new courses that'll be coming out next quarter. But I think education awareness is key in trying to address health literacy and make progress.
Absolutely, absolutely. And so, can you tell us more about the measures of success? You have these partnerships, these programs. How do you know if they're successful? What are those measures?
Yeah, so we have something that we call, behavior change teams. One of the key things for health equity initiatives that we have is measure what matters, right? It's like a key pillar that we have.
Excellent.
And we have to showcase improvement and year-over-year progress towards these. So when we send out any campaigns, it could be print, it could be digital, it could be outreaches, the team is always on point for identifying and saying, are we making progress, right? Are people opening the emails that you send them? Are they opening the email the first time? Are they opening it the 3rd time that you sent them? Are they taking an action? Is there a behavior change after we have provided them with healthy coaching? Is there a behavior change? Are they closing a gap? And so, behavior change and measurement is very key to us. The other aspect is, last year, CMS notified us that for all Medicare Advantage organizations, they have introduced a health equity index reward. And what this does is it forces all MA organizations now to report performance on multiple metrics, especially for the low-income population, the disabled population, and people on Medicare and Medicaid, right? So your duals population. Mm-hmm. And now every year, we have to showcase that not only are we having initiatives, but we're measuring progress and submitting this progress to CMS. This is a huge game changer for Medicare, probably one of the biggest that has happened in the last decade. And it's going to force a lot of organizations now to really evaluate the performance specifically for underserved populations.
Mm-hmm. Now, for me, success is measured in terms of outcomes. We've talked a lot about how health literacy impacts outcomes.
Yes.
So I want to see what difference we're really making. I want to see those outcomes improving, and I'm happy to be able to share that in our multicultural care management that's part of our health equity program. We have seen a reduction of inpatient admissions for our highest risk members. And then for the population that our community health workers have been intervening with, we've been able to see an 8 percentage point improvement in the rate of diabetics using statins or cholesterol-lowering medications. That helps reduce their cardiovascular or risk for heart disease. We've also seen double-digit improvement in blood pressure control, in diabetes control, and also flu vaccination rates. So this is all really very encouraging and letting us know that we're on the right track.
Mm-hmm. I like those trends. And so over what period did you see those reductions?
So for the For the care management piece, that was in our initial year of the program, so over a year's time. And we are in the process of looking for updated results right now. Our clinical analytics team is working on that. And also for the community health workers, that was over the first year of their work as well. So over the past year, because we started that aspect of the program a little bit later. So.
Great.
Yeah. One additional thing is, one of the typical symptoms of people with low health literacy is they tend to miss their appointments, right? Or they show up on the wrong day or the wrong time for the appointment. And so completing, especially for the aging population, completing an annual wellness visit really helps us better understand the problems that our seniors are facing. Mm-hmm. So one of the initiatives that, we had done is where we outreached to all members who had missed an appointment. Especially for their annual wellness visit. And we saw about a 13% increase in completion rates just by a targeted outreach to people who had missed their appointments, right? And it was for multiple reasons. So, so I think there's multiple layers in this, and, it's like we have to make sure that as part of the ecosystem, we're all addressing this from multiple angles.
Yes.
One other thing, that CVS Health has is a lot of community clinics, and Oak Street has about over 200 clinics. And they are specifically located where we have or we see a lot of members or populations with disparities. And an average provider there takes 45 minutes to talk with a person. And 45% of the people who have come to these community clinics complete an assessment, and they have been identified as having low health literacy. So, we measure everything that matters, but, as we make progress on this in the spectrum, right, it's an interconnected ecosystem, and that's where on every touch point that a member has or a senior has, whether it's the pharmacy, whether it's a website, whether it's print, whether it's reading materials, it becomes extremely important. We also have an internal team called We Speak Human. And this team came out of an innovation challenge, right? And the team, all that they did, and this team was founded a couple of years ago, is they take materials that are going out to seniors and they rewrite them in simple, plain language. And this team has seen a huge success, right? Where then we've gone back and we've said, have these materials helped you? Do you feel they are something that's more understandable? Do you feel you're able to take action based on these? And we've received, positive responses there. Last year, one of the things we piloted was on a member's ID card, we put a QR code. And so if you scan the QR code, it takes them directly to a website where in simple English, it tells you what are all the benefits that you're eligible for. And within a month of launching that, we had over 500,000 hits. And it was a massive success, right? And so it tells you that when you simplify things, when you put them, in plain language, in pictures or pictograms, people are willing to take that information in and utilize it. Mm-hmm. And this is especially important because, we spoke about how there's so many people aging into Medicare. A lot of people aging into Medicare now are more familiar with technology than they were 10 years ago.
Yes.
So it's very important that we make sure digital literacy is a key component of any strategies or initiatives that we unveil, right? Because people are coming in with a higher expectation of what of the healthcare ecosystem, whether it's, applications, whether it is just social media, their expectations are much higher.
I wanted to follow up on something you were talking about, Kavitha. And that's about the ecosystem and how everyone needs to do what they can to help advance health literacy. We spoke about the challenges that come with some of the aging processes.
Yes.
There are steps that can be taken to mitigate the impact of some of those challenges. And they're not rocket science, it's just we need to be aware and think about it and be committed to using them. So relative to the issue with cognition and the slowing of the speed of processing, repetition is key. You know, if people would think about when they're interacting with seniors who might be dealing with this, repetition is key. You want to focus on what's the most important message. What is the gist of what we're trying to say? And like shorten the conversation, focus on what's important, focus on the directions that people need to follow once they leave, and use tools to help reinforce and recall and memory, like pamphlets and brochures. For vision problems, and I can tell you that these things definitely work. I've been visually impaired for like the last 40 years or so, and it's really very simple. It's contrast, contrast, contrast. So you stop the fancy, go with black ink, white background, large font, 16 to 18 point font. Again, focus on what's important, minimize text, put spacing in between lines so people can easily follow along and not get lost. Don't use glossy paper. You know, if you're dealing with someone who is hearing impaired, what you want to do is try to eliminate or minimize background noise. You want to speak clearly, maybe a little bit louder. Don't yell at people, though. Don't speak while chewing gum. And as I was researching this, it also said don't speak while eating. Now, you shouldn't do that anyway because it's a choking hazard, so you don't want to do that. But again, there's these simple steps that can be taken to minimize the impact of some of those changes with aging.
Yeah, and some of that sounds like it would be appropriate for any age, right?
Yes.
Repeating messages, repeating it gets that information across. So, especially when it comes to healthcare, sometimes people get nervous,
Right.
and they can't hear clearly because they're anxious, right?
Correct.
Yeah.
Yes.
Well, this is fascinating. So, in summary, I'd like to ask you both, what are some of the key priorities that you have with health literacy at Aetna? And what can CBOs do in terms of activity to engage older adults with health literacy and make smart decisions about their health care?
I think the biggest thing for me is just making sure that there's awareness that health literacy definitely impacts healthy aging and it plays a role in making sure good, strong health literacy skills helps us empower our seniors to be able to have the kind of retirement, enjoy the kind of later years that we've probably all envisioned for ourselves. But again, you can't do that if you don't have basic health literacy skills. We want to take those small steps, even again, doing the simple things we just talked about with addressing it, you know, how to minimize the challenges of aging and allow people, you know, empower them to take an active role in their health, to prevent disease, manage their chronic disease, so they can be healthier, more active, enjoying life. And I guess as far as CBOs, I think the information, some of what you said, you know, looking at what's important in the community, one size doesn't fit all, but you have to know what the needs are of that community and what will work in that community, and you guys are positioned perfectly to be able to be aware of that and implement that. So going down that path, but every part of the ecosystem has to do their part, whether it's health plans, CBOs, providers, or so on.
Yeah, I think, you know, health literacy is a national issue, right? But it's not a one-size-fits-all approach. Now, I represent Aetna CVS Health, right? And as an insurance company, we're not as trusted as the CBOs are. Like, I feel community-based organizations, you are in a much more strong position of trust and interaction with the member. And that's the opportunity that you have, right? For us, right, we can think about CVS pharmacy, and the pharmacist is in a position of trust. So as we have this ecosystem, if those of you who are in those positions of trust can work with the seniors, it is a national problem, but the solutions are local because every senior is different. And if we can understand and encourage them to be comfortable in asking questions. Maya Angelou once said, nobody's going to remember, who you are, what you did, but what people will always remember is how did you make them feel. And it's very important that seniors should feel comfortable enough that they can ask those right questions and be comfortable enough that as they interact in multiple touch points, they are not ashamed. And no question is a dumb question. And they are comfortable with saying, can you repeat this for me? Or can I bring somebody with me, right? I used to accompany somebody for their, who had a cancer diagnosis for their chemo sessions. And I would go with her, and her reason basically being, she would say, I'm overwhelmed by my diagnosis, and I'm not in the right frame of mind where I can ask the right questions. So take somebody along or encourage seniors to take somebody along who can ask the right questions and who can help them in that time of need, right? So we all have a role, we all have a responsibility, and I feel if each of us, create that sense of trust with seniors, we will make tremendous progress at the grassroots level.
Yes, thank you. It's all about the grassroots, isn't it?
It is.
Well, this has been a really informative conversation, and I appreciate you both being here this afternoon. I understand you'll be sticking around for questions if there's any questions from the audience. Please join me in thanking our panelists this afternoon.
Thank you. Appreciate it. Thank you, Dr. Alena.
Thank you.